everyone from CAHO Continuing Quality Education series of webinars. This is a 25th CQE program in the series organized by Quality Professional Wing of CAHO. I am Dr. Amita Marla, working as Director, CEO of Ajo Hospital and Research Center, Mangalore, and I am a part of this governing council of CAHO as an executive committee member of CAHO SEC, a student engagement committee, where we deal with SACON for student training conferences and certain training programs for students. CAHO is a non-profit organization dedicated to promoting patient safety, quality, and accreditation in the healthcare delivery ecosystem. Through structured training programs aimed at imparting relevant healthcare quality skills to healthcare workers, CAHO has trained more than 16,000 clinical and non-clinical healthcare professionals till date. CAHO is an institutional member of ISQA, that is International Society for Quality in Healthcare, and Asian Society for Quality in Healthcare, the ASQA, and an elected member on the executive board of ASQA. CAHO is led by visionary leadership team headed by Dr. Vijay Agarwal, Mr. Sam Mehta, and Dr. Lalu Joseph. This webinar is organized by the Quality Professional Wing of CAHO, and Dr. Anuradha Pichumani and Dr. Suvin are in charge. It is one of the three main verticals of CAHO and is dedicated for nurturing the professional needs of healthcare workers, especially those responsible for quality in their institutions. CAHO's Continuing Quality Education webinar is a 3-hour virtual conclave conducted on last Saturday of every month. The sessions are aimed at educating healthcare workers throughout India and elsewhere, and on best practices to adopt and implement with goal of improving patient safety and quality in care delivery. The theme for today's session is quality and safety in pharmacy practices. On behalf of Governing Council of CAHO, I welcome everyone to the program and look forward for engaging session from all the speakers. It's my privilege to introduce the organizing chairperson for today's session, Ms. ManishaPal. She is the General Manager Pharmacy at Dr. L.H. Hiranandani Hospital, Mumbai. I request her to take over and proceed forward and introduce the organizing team and the speakers of today. Thank you.
Everyone, I am ManishaPal, Pharmacy in charge at Dr. L.H. Hiranandani Hospital, Mumbai. Welcome you all on behalf of CAHO and Asian Society for Quality in Healthcare. It's a great privilege to have this kind of program in quality and safety practice in pharmacy. And CAHO is one of them who focus is mainly on safety culture, promoting patient safety and quality of care. As we all know, all over the world, patient safety has become a huge concern because of numbers of medical errors, medication errors taking place. I would personally thanks to all the accreditation bodies like NABH, JCIs, who have structured and set a system in place for all of us working in hospital to find out how to identify and prevent these kinds of medication errors. As we know, pharmacists make sure that correct medicines are given to correct patient, but still we have to work towards safety culture. Healthcare needs to view all errors as an opportunity because we have to identify each and errors taking place and identify how to improve system and processes to catch these mistakes that are caused by human errors. Hospitals should employ the same type of safety groups that are not only incorporate risk management, information technology, and nursing, but also include actual clinicians who work with the system and interact with patients and their orders. As you know, there should be multiple pathway provided for the employees to bring suggestions for these kind of errors, concern to the group to look at the system and make it a better not just by reporting them with no follow-up and breakdowns the process that leads to a particular mess up. We have processes in every organization and rules to make a hospital safer, but the culture can be so tainted that no one follows the protocol that are in place. It is true that when you start looking at safety through the lens of culture, you see how challenging it is to change. Safety cultures start at higher level of every organization, where management, doctors, everyone has to include. Then only it get tapers down to the employees who are working below them. As all of us know, this is not one person's job. Each and every person who are involved, like doctors, nurses, pharmacists, have to take the responsibility to work towards patient safety. And not only the healthcare workers, WHO says that patient involvement is must. Medication safety or patient safety is a responsibility played by patients themselves. So patients have to be partnered in this safety program. I congratulate Kaho, who is on a continuous mission on working towards safety by various means. So let's start with these few words. Now I would like to introduce Dr. Zareen, who is an organizing secretary. Dr. Zareen is a former head of pharmacy at Safi Hospital, worked for last 25 years of her career. She is MPharm in pharmacology and did her PhD in pharmacy practice. She is an active member of Indian Pharmaceutical Association. And we have our today host, Ms. Neha Kamath, who will be taking today's program. She is an executive pharmacy at Dr. L.H. Hiranandani Hospital. So, Sneha, you can take the program ahead.
Thank you, Manisha ma'am.